people cannot control when and where they urinate. Some people cannot even control having a bowel movement. This is a problem for elderly people more commonly than younger people. It's not their fault, and it is not a normal part of the aging process. Rather, it's a health problem, and you're key to helping change this. Hi, I'm Kathy Getrust, and I'm an instructor in community health. Today's topic of discussion is going to be on bowel and bladder retraining. We'll begin today's discussion by watching a segment of a videotape that's been graciously supplied by the Paper Pack Products Company, a company which manufactures disposable incontinence products.
Welcome to the Attend's Advanced Skin Health System, the incontinence and skincare system designed to help caregivers provide quality care, help maintain healthy skin, and manage related costs. In the first section of this videotape, it's an introduction to incontinence and its effect on skin health. You'll also learn about the Attend's Advanced Skin Health System and its comprehensive approach to managing incontinence to help maintain high health skin. Incontinence is the inability to control urination or movements. It can range from tiny pills to complete loss of control. It affects more than 10 million people in all walks of life and at all ages. And it can lead to personal embarrassment, isolation, and serious skin problems. Although it is most common in older adults, it's important to remember that incontinence is not an ordinary part of aging. And incontinence is not an illness in itself, but rather a symptom, a sign or outcome of some other illness or physical problem. There are two different kinds of incontinence: bowel or fecal incontinence and urinary or bladder incontinence. Bowel incontinence is the inability to control the passage of feces. It is caused by diseases or injuries to the nervous system, or by problems or weakness in the colon, rectum, or anus. It can also result from physical or emotional barriers to getting to the bathroom. Urinary incontinence or bladder leakage is the most common form of incontinence. It occurs when the bladder contracts or empties when it shouldn't, or when the bladder's outlet or sphincter opens or closes at the wrong time. Its cause can be problems in the urinary tract, the pelvic floor muscles, the spinal cord, and even problems in transmitting messages to and from the brain. If any one of these areas is unable to function normally, a person loses bladder control and urine is released at the wrong time. Here are some of the most common causes of urinary incontinence. Relaxation of the pelvic muscles. This is often seen in women over 35 who have had several children. Reduced pelvic muscle control, which can occur with menopause. Infection or inflammation of the bladder or the urethra, the tube that leads from the bladder to the outside of the body. Nervous system disorders, which can result from birth defects such as spina bifida, from brain damage or stroke, from diabetes or a spinal cord injury. Neuromuscular diseases such as multiple sclerosis, muscular dystrophy, and cerebral palsy. Damage due to injury or as a side effect of some types of surgery. And finally, certain medications, as well as caffeine and alcohol, can make incontinence worse. How severe a problem is incontinence? It varies from person to person and even from day to day. Generally, there are 3 degrees or levels of severity of incontinence. Light incontinence is occasional uncontrolled dribbling and spilling of small amounts of urine. Moderate incontinence is partial loss of control, resulting in voiding of small to moderate amounts of urine. Severe incontinence is uncontrolled total voiding of moderate to large amounts of urine and/or stool. In addition to degrees of severity, incontinence is also classified into 5 main types. Stress incontinence. This is the most common type of incontinence. It is the involuntary leakage of small to moderate amounts of urine following sudden stress on the bladder or sphincter, such as coughing, laughing, sneezing, bending, or lifting. This condition is most often associated with a weakness in the pelvic floor muscles. Urge incontinence. This is the loss of moderate to large volumes of urine in conjunction with a sudden need to urinate that is so urgent it can't be held back. It results from an overactive bladder contracting when it shouldn't, because the brain's ability to transmit has been inhibited by a nervous system disorder, such as a stroke or a disease like Parkinson's. Overflow incontinence. This is the leakage of moderate amounts of urine from a chronically full bladder. It is caused by an obstruction, such as an enlarged prostate, or a problem in the bladder contracting or emptying mechanism, resulting from medication, a disease like diabetes, or spinal injury. Reflex incontinence. This is complete loss of control, most often due to an injury to the nervous system that blocks messages between the brain and the bladder. It is the most severe type of urinary incontinence and typically results in the loss of large amounts of urine. Functional incontinence. This results from a physical or emotional barrier to toileting. Examples of physical barriers are immobility, an inaccessible bathroom, and bed rails or other restraints. Disorientation, depression, and behavioral problems are examples of emotional barriers. Whatever the cause or severity of incontinence, our primary goal is to protect the person's health and dignity. Incontinence can often be treated and cured with medication, surgery, or behavioral programs like bowel and bladder retraining. Always consult a doctor for a thorough evaluation of any incontinence problem and a plan for treatment. For many people, however, incontinence is managed through use of disposable absorbent containment products combined with quality skin care. Perineal care, often referred to as pericare, the regular cleansing of the skin in the genital and anal area, is an essential part of quality incontinence care. The goal is to help maintain healthy skin and assure that each person receives the quality care he or she needs to achieve the highest practicable level of functioning and quality of life. Quality incontinence care is important because incontinence is a predisposing factor for skin breakdown. Skin that is soiled or continuously wet is more easily attacked by bacteria or fecal enzymes that can cause rashes, infection, and skin breakdown. The skin may also be prone to fungal diseases such as yeast infections. This skin breakdown can lead to diminished quality of life and to very serious health problems, even pressure ulcers, when combined with pressure and immobility. The elderly are especially at risk because as we age, our skin becomes thinner, less flexible, and more easily damaged, and it heals more slowly. Along with incontinence, the elderly also frequently suffer from other predisposing factors to skin breakdown and pressure ulcers, poor nutrition and hydration, and the loss of mobility, peripheral nerve sensation, and fat and muscle tissue. So it's especially important for older persons with incontinence to protect their skin against exposure to urine and feces. Urine typically has a higher pH value than skin, and increased skin pH can make the skin more susceptible to attack by fecal enzymes, leading to skin breakdown and infection. In addition, exposure to urine moisture can leave skin excessively wet. This can cause maceration, unusual softness that makes the skin vulnerable to bacteria and more sensitive to abrasion. It can also increase the risk of skin rash or perineal dermatitis, and even the risk of pressure ulcers in immobile individuals. An important part of the caregiver's role is to watch for early signs of skin breakdown, including maceration and redness, rash, or any skin irritation. The Attend's Advanced Skin Health System offers a unique combination of absorbent and pericare products, education and professional support, and value to help provide the best incontinence care possible to help maintain healthy skin. Attend's comprehensive line of technologically advanced products is designed to meet the individual needs and care plans of people with all types and levels of incontinence. When used properly as part of an overall program that includes frequent checking, changing, and thorough pericare, Attend's products help maintain dry, healthy skin. Let's look at the technology of Attend's products to see what makes them so effective. Attend's containment products with advanced perma-dry technology absorb moisture faster than leading competitive products and help lower and control urine pH. Attend's unique four-part design helps maintain dry, healthy skin. Here's how. First, Attend's soft, comfortable Stay Dry liner has thousands of unique one-way funnels that whip wetness away from the skin quickly, keep it away. Second, perma-dry fibers are centered in the core layer to pull wetness away from the skin and distribute it to the core quickly. Third, a thin ultra tissue traps the wetness away from the skin. And fourth, Attend's locks wetness inside the core with Aqua Absorb, an advanced absorbent gelling material distributed evenly throughout the core. In this demonstration, it's easy to see how fast Attend's absorbs wetness, faster than the leading competitor, and keeps it locked away from the skin to help maintain dry, healthy skin. And as urine passes quickly through the Attend's perma-dry fibers, its pH is lowered closer to that of normal skin. Lower urine pH reduces access of fecal enzymes to the healthy skin layer to help reduce the risk of skin breakdown. Selecting the best Attend's product for a particular person depends on a number of factors, including the type and severity of the person's incontinence, the person's mobility or lack of mobility, and ability to help himself or herself. The person's medical care plan, including, for example, a program for scheduled toileting or bladder retraining. Attend's has containment products for the full range of incontinence needs, from severe to moderate to light. For severe to moderate incontinence, Attend's briefs, pad pants system, and undergarments all use perma-dry technology to lower the pH of urine and wick, pull, trap, and lock wetness away from skin quickly. For people with severe incontinence, especially those who are immobile and spend most of their time in bed or in a wheelchair, Attend's briefs and briefs with waistband are often the best choice. Both feature a comfortable notched core, soft leg gathers, and refastenable tapes. The Attend's pad pant system or undergarments are ideal for more mobile people, especially those on a program of scheduled toileting or bladder retraining. The Attend's pad pant system includes body contour disposable pads available in different levels of protection. The pads are designed for use in reusable underwear. For more independent people, those who can use the toilet without help, Attend's undergarments have a reusable belt system that is designed to provide a discreet, comfortable fit, and they're easy to pull up and down. For moderate to light incontinence, choose Attend's beltless undergarments, insert pads, guards, or discreet pads, all designed to provide a close, comfortable fit in regular underwear. Attend's underpads provide added protection to keep skin dry and protect bed linens. Patented embossing in the core facilitates wicking of liquid away from the center of the underpad. In addition to absorbent containment products and underpads, the Attend's Advanced Skin Health Systems product lineup also includes Attend's washcloths, which provide soft, lotion cleaning to help keep skin clean, important to maintaining healthy skin. In just one simple step, Attend's washcloths help maintain healthy skin by gently cleansing urine and feces from the skin and moisturizing it with soothing, lightly scented lotion. Attend's washcloths are available in resealable tubs and economical drop-in refill packs for a great value. The Attend's Advanced Skin Health System also includes education and training materials specially designed to help caregivers provide quality care for incontinence and skin health. And registered nurses are available at 1-800-4-ATTENDS to answer questions about the use of Attend's products. Attends has been helping caregivers provide quality incontinence care and dry, healthy skin for more than 15 years. The Attends Advanced Skin Health System, with its full line of advanced technology incontinence care products, plus caregiver education and service, reflects that commitment to quality care. Together with quality incontinence and skin care, the Attends Advanced Skin Health System helps maintain healthy skin. And healthy skin means lower skin treatment costs and better quality of life.
You've just learned about the causes and health effects of incontinence and some of the different kinds of incontinence products that can help contain urine and stool. Healthcare facilities have medically approved bowel and bladder retraining programs to help residents who are incontinent. Most of the time, the toileting treatment plans are written out in the care plan. So it's extremely important that you follow the care plan carefully and consistently. Relearning bowel and bladder control is time-consuming. It requires a great deal of patience and understanding. But when it's accomplished, it's very rewarding not only for the patients, but also for the staff. The patient is able to become more independent and will gain a great deal of self-confidence and self-respect. I'd like to describe, first of all, a typical bowel retraining program. There are a variety of methods to retrain someone who has had incontinence of bowel movement. This would be the components that would be a part of the majority of retraining programs that you might see. The first thing is that you must observe the resident's normal bowel pattern. As you know, some people have a bowel movement every day normally, some people every 2 days, sometimes every 3rd day. It's not common for us to have a bowel movement at the same time of day as well. So it's important to observe the individual and find out when they're having their bowel movement. The next part of the retraining program is that the patient is placed on a regular eating schedule, and they're generally provided with a high residue or high fiber diet. This diet contains a good deal of water. We're talking about 2 to 3 quarts of water or other liquids for the individual each day, unless for some reason it's medically contraindicated to give them that much liquid. Ambulation and exercises are also a part of a retraining program, particularly ones that would help strengthen the individual's abdominal muscles. The patient must have ready access to the toilet, must have privacy to be able to have a bowel movement, and part of the retraining program would have the individual placed on a regular scheduled time for a bowel movement. Typically that would be about 30 minutes after breakfast. Typical bladder retraining program, remember now, a bladder retraining program would help the individual regain control over their voiding or urination. Again, they must be observed for finding out how frequent they are urinating. And it could be every 2 hours, it might not be, but every 4 or 5 hours. So observing their normal pattern before starting the training program is key. Then the individual is typically toileted on awakening, toileted before meals and after, and then again at bedtime and at least once during the night. They too are provided with a daily fluid intake of about 2 to 3 quarts, again unless there's some medical reason why that would not be advisable. The exercise program that they might be placed on would be a program called Kegel exercises. Kegel exercises help exercise the pelvic muscles. The pelvic muscles are the muscles that we have that control the starting and stopping the stream of urine. By practicing starting and stopping as though you were going to be urinating, the individual strengthens those pelvic muscles. Frequently, they will tighten those muscles and relax them about 10 times for the exercise, and that might be done 4 to 6 times in a given day. There are also some support measures that need to go along with a continence control program. The person needs to be well groomed and have good personal hygiene during the retraining program, as with any other time. A person is going to have more incentive, feel more incentive to be continent, to work hard at not having these episodes of incontinence if they feel good about the way they look in the other areas of their personal hygiene and grooming. They should be dressed in their street clothes and shoes, not be allowed to be in nightgowns or pajamas through the course of the day. Encourage attractive physical appearance. Also involved in social activities. Indifference and lack of mental stimulation may lead to incontinence. Patients that are more likely to be incontinent are ones when they are isolated, ignored, or left unattended for long periods of time. Praise and encouragement during the retraining program is also important. Never show hostility or disapproval when an individual has an accident and wets or soils their clothing. Our facial expression, even if no words are uttered, send a very strong message of whether or not we are accepting them, regardless of whether they are continent or incontinent. Instead of showing hostility, give them encouragement to try again, and very likely next time you could be successful. You as a caregiver are key to a successful retraining program. When caring for patients that have had problems with incontinence, there's a few things that are important to remember. The first is answer call lights promptly. Keep assistive equipment within easy reach for the individual. That might be a wheelchair or a walker. Oftentimes, urgency is a concern in having a bowel movement or urinating. So having those things readily accessible may make the difference between them having an incontinent episode and making it successfully to the bathroom. Keep the path to the bathroom clear and well lit so that they might not fall in their transit. Until a retraining program is successful, special clothes protectors may need to be used. As a caregiver, it's important that you never use the word diaper. That word has association of being an infant or childlike. Neither one of those associations are appropriate when you're talking about adults. Instead, use words such as briefs, garment protectors, or underpads. I have some examples here that I'd like to show you. This is a disposable brief, and it has tabs that get put on the individual and secured. They come in numerous sizes, and you'll find out more about the appropriate sizing depending on the type of product that you use. This is also a brief that is not a disposable one. This has snaps instead of sticky tabs like the disposable one did. This one, when it becomes wet, does not get disposed of, but it is washed in the laundry and then may be reused again. These also come in different sizes, small, medium, and large. You notice that there's a soft cotton interior, and there's an impermeable barrier that prevents moisture from going through onto their clothing or onto their bed. That's true of the disposable ones as well. This particular style is a panty as opposed to a brief. This is worn just pulled up like an under panty would be, but it is disposable, and if it gets wet with urine or stool, it can be disposed of. I have a couple of examples of underpads. Sometimes the individual will just have an underpad on the bed or in their wheelchair. This is a small disposable underpad, a softer material that's next to the patient, and an impermeable backing that's made out of plastic. This is a small one. This is the same kind of underpad, about the same size, but is a reusable one, made out of cotton on the interior and something that prevents moisture from leaking through on the other side. This is also an incontinence pad. This is not disposable either, but is a reusable one, and you can just see that it's quite a bit larger. This is also used sometimes as a lifter sheet for helping lift the individual up in the bed. It's important to maintain a positive attitude when changing soiled garments and linens, to communicate acceptance of the individual regardless of what's happening with their continence or incontinence. Change wet clothing and linens promptly. Keep the skin clean and dry, and use barrier creams if necessary to protect the skin. Urine and stool both have strong toxic chemicals in them that will cause skin breakdown if it's left on the skin too long. So it's important to get them removed as quickly as possible, and barrier creams. I have some examples of barrier creams here. Some are a white thick cream that is not water soluble, and some come in a spray as well, and some are cotton tipped applicators, all for the same purpose of providing a barrier so that urine and stool do not cause skin breakdown. Keep pads and clothing wrinkle-free so that, again, there is no damage to the skin. Now I'd like you to watch a demonstration of changing an incontinence brief. Changing an incontinence brief. Wash your hands and obtain needed supplies. Apply your gloves. Fan fold the top linens to the foot of the bed. Cover the patient with a bath blanket. Loosen the brief tabs and fold the brief between the thighs. Wash, rinse, and dry the perineal area thoroughly. Apply barrier cream if needed. Assist the patient to lift or turn onto their side. Remove the soiled brief and place in a disposable plastic bag. Clean and dry the rectal area thoroughly. Apply barrier cream if indicated. Apply a clean incontinence brief according to the product directions. Arrange clothing and replace any that are soiled. Remove your gloves and dispose of the soiled brief in the plastic bag or per facility policy. Wash your hands. Report and record any observations.